The really critical finding here is that these extremely obese teenagers with diabetes were able to lose a third of their weight and come off of diabetic medications. This study looked at diabetic teenagers who were extremely obese, and a total of 78 patients were involved in the study, 11 of whom underwent bariatric surgery. We looked at their health and their weight loss outcomes over the course of 1 year. What we anticipate with these patients who are seeing complete remission of their diabetes in teenage years after bariatric surgery is a dramatic improvement in their cardiovascular health, reduction in their risk of renal failure, and a reduction in their risk of early blindness. Type 2 diabetes is an incurable condition. The fascinating thing that we've been able to find with this study is that teenagers who undergo gastric bypass surgery can see almost complete remission of their diabetes. This has enormous implications for their future health, including cardiovascular health and kidney health. While there can be complications of surgery, the real story here is that the risks and the complications of diabetes may be completely averted having undergone the surgery. The Centers for Disease Control predicts that a third of all toddlers will develop diabetes in their lifetime. Cincinnati Children's Hospital has been forward-thinking for years now and has taken the most aggressive stance of any pediatric medical center in the country against diabetes as well as obesity.
Here we are, have a seat, and I'll be right back with you, okay?
And his BMI to 262, and his BMI has been hanging in the 44 range. Okay. All right.
Cardiology released him too, his hometown cardiologist said, and then that's the one with Dr.
Very good.
Okay. All right.
Hey Austin, how are you? Good. I want to talk to you a little bit today about what we're going to be up to. Dad's questions are answered before we go through with this, okay? But I'm excited about it. I think that you're. I think that there was probably a little bit more variability, of course, to lose weight pretty quickly, pretty dramatically. You'll have an immediate change.
Now Dad's coughing. What are we going to do with you guys?
About a third of your weight, maybe even more. You lose, right? So if you're going to get in 2/3 less fluid in your food and 90% thinking processes after surgery. My personal belief is that I don't mind come up on the table and I'll just do an exam here. I'm going to listen to your heart and I'm going to listen to your lungs and make sure that you're fit for this surgery. Dad tells me deep breath. Okay. And big breath into your lungs. Can you take deep breaths for me, okay? All right. Remember, she's going to make you. Okay. Deep breath. Okay. Very good. Deep breath. And deep breath. Okay.
He took note when I said don't pay attention to the camera. He's doing a great job. Most people can't help but just every once in a while blink up at it. And he hasn't even looked at it
Sore
once.
spots there. Can you open your mouth up real wide and say ah, ah? Okay, good, good. And listen to your carotids here. Listen for any turbulent flow there.